These are stressful times. There's no doubt about it. Just about everybody is under some form of excessive stress. We live in an era where you have a disease, a pandemic, such as COVID-19, where, I mean, a lot of people aren't vaccinated. They refuse to get vaccinated. And then you hear news that even the vaccinated people can get it. I'm talking about the Delta strain. Then there's new variants that are popping up all the time. It seems like it's never going to end. So that's just one source of stress. Other sources of stress, some people who are collecting unemployment can't get it anymore. They're going to be in trouble. They can't get a job, or the jobs don't pay enough. I can go on and on. But stress is it's universal. Everybody suffers some form of stress. But I mean, we talk about stress in general terms, but basically it's a state of a mental or emotional strain caused by any type of adverse circumstance. Most people deal with stress. One study found that 33% of adults reported experiencing high levels of perceived distress. That's 1/3 of everybody is under some form of high stress. And unfortunately, stress is associated with a long list of physical and mental symptoms. In my Applied Metabolic newsletter, www.appliedmetabolics.com, I'm going to have an upcoming article on the real effects of stress on health. A lot of the effects of stress on health that are widely believed are not necessarily true. And I will be talking about this. I've never seen anyone write about this other than in hardcore psychology journals. So I'm going to be writing about it in Applied Metabolics. But today, I want to talk about some typical signs and symptoms of too much stress. One of the signs of too much stress is acne. Acne, from the traditional medical viewpoint, is caused by overactivity of the oil-producing glands in the skin, known as the sebaceous glands. They secrete an oil that lubricates the skin. However, sometimes it gets overactive. You get a certain type of bacteria called P. acne bacteria, which tends to, they like the oils that are secreted by the sebaceous glands. They kind of use them as food. Unfortunately, they produce toxins, this bacteria, that inflames the skin pores, leads to things like whiteheads, blackheads, and then full-fledged acne. That's the traditional view. As a matter of fact, when you take anabolic steroid drugs, one of the typical classic symptoms of high-dose steroid use is acne, and particularly on the upper back. It can be anywhere, but the upper back can sometimes get what they call cystic acne, a really bad type of acne. It's literally open sores all over. It looks horrible all over the back, and that is caused by the anabolic steroids stimulation of the sebaceous glands, stimulating acne. But stress itself can actually cause acne. They're finding that certain foods, in the past they discounted nutrition as not being completely unrelated to acne. Now they know that certain foods can possibly exacerbate or stimulate an acne response. For example, they think that foods that stimulate insulin-like growth factor 1, IGF-1, such as milk. There's studies indicating that whey protein can also stimulate acne in teenagers. I've used whey protein for years. I've never gotten a single acne lesion, but apparently some people are more susceptible than others. But there's some evidence that stress can actually cause acne. But the question is it the stress itself, or is it things that happen when you're under stress? Like, let's say you're having the beginning of acne, and you start picking at them and stuff like that because you're under stress. Well, that can make the acne come out to full bloom. But there was one study that measured acne severity in 22 people before and during an exam. Increased levels of stress as a result of the exam were associated with greater acne sensitivity. Another study of 94 teenagers. Now, teenagers usually have the greatest number of cases of acne usually occur in teenagers. And the reason for that is very simple. The teenagers, when you're a teenager, as soon as you hit the teenage years, your body starts secreting extra amounts of DHEA, dehydroepiandrosterone. DHEA is known to stimulate that sebaceous gland oil effect I mentioned earlier, and there's your acne. So it's basically the elevated levels of hormones in teenagers that cause the acne. Of course, again, not every teenager gets acne. But a study of 94 teenagers found that higher stress levels were associated with worse acne, especially in boys. Again, boys secrete more androgens, such as testosterone, DHEA, and androgens are associated with acne. Estrogen is just the opposite. Estrogen, which is the predominant sex hormone, if you want to call it that, in women, is associated with decreased acne. But that's the way it works. Now, the question is, why would stress cause acne? Again, nobody knows the exact reason, but the proposed mechanism includes increased glucocorticoids and adrenal androgens, which are known to worsen acne and increase sebaceous hyperplasia. In other words, they increase the size of the sebaceous glands, which again releases more of the oil which is acted on by the acne-producing bacteria. Corticotropin-releasing hormone, the body's coordinator in the stress response, was found to increase sebaceous lipogenesis, secretion of the oil, and upregulate sepocyte conversion of androgen precursors into testosterone. In other words, it would actually would be in the sebaceous glands. This CRH, corticotropin-releasing hormone, which stimulates the release of cortisol in the body, actually gets into the cells that produce the oil, and it can turn something like DHA directly into testosterone, which again makes the acne even worse. There's also research suggesting that stress-induced release of neuroactive substances within the epidermis or upper lining of the skin can activate inflammatory processes in the skin. Recently, substance P, a neuropeptide elicited from peripheral nerves by stress, was shown to stimulate the proliferation of sebaceous glands and to upregulate lipid synthesis in sebaceous cells. Psychological stress, including examination stress, can slow wound healing by 40%, which could be a factor in the slowing and repairing of acne lesions. So there's your mechanism. Another possible sign of increased stress is headaches. I've gotten that myself when I'm under stress. Stress can contribute to headaches, which of course is a pain in the head. Headache occurs not in the brain, but in the blood vessels just in front of the brain, the superficial blood vessels. A study of 267 people with chronic headaches found that a stressful event preceded the development of chronic headaches in 45% of cases. A larger study showed that increased stress intensity was associated with an increase in the number of headache days experienced per month. Another study surveyed 150 military service members at headache clinic, finding that 67% reported their headaches were triggered by stress, making it the second most common headache trigger. There's other things that stimulate or trigger headaches. They include not enough sleep, too much alcohol intake, and dehydration. Not drinking enough fluids can also cause a headache. Another sign of increased stress is chronic pain. One study made up of 37 teenagers who had sickle cell disease found that higher levels of daily stress were associated with increase in same-day pain levels. Another study compared 16 people with chronic back pain to a control group. It found that those with the chronic pain had higher levels of cortisol. Cortisol is a hormone, adrenal steroid hormone, reduced when there's greater levels of stress. Another study showed that people with chronic pain had higher levels of cortisol in their hair, and that, again, a sign of increased or prolonged stress. So chronic pain could be another possible sign of stress. If you're frequently sick, that's a sign of increased stress, because when you're under increased stress, as I said, your body secretes certain hormones that tend to dampen immune response, such as cortisol. What cortisol does, it kind of lowers the activity of immune cells that normally protect you against disease. So if you, let's say you're exposed to a pathogen or a disease-causing organism and you're under a lot of stress, your immune system might not be working up to par, and where you normally might be able to fight off that pathogen, because you're under stress and your immune system is depressed, you will get sick. I kind of have a theory, I don't have any proof to believe this, but they have a situation going on where people who were vaccinated twice against the COVID-19 vaccine, they nonetheless acquired the disease, particularly with the Delta variant, which is, I believe, 9 times more transmissible than the original Alpha variant. However, I think there's a stress component. because all vaccines work in tandem with your immune system. If your immune system is not working right, the vaccines won't be as effective. I believe that people who have been vaccinated and have the so-called breakthrough infections, meaning they get COVID even though they've been vaccinated, it probably happened when they were under a lot of stress and their immune system was depressed. Because of that, the vaccines couldn't protect as well, and they got it. It's just a theory of mine, because it's very hard to explain how these people can actually get COVID even though they've been vaccinated. In one study, 61 older adults were injected with the flu vaccine. Those with chronic stress were found to have a weakened immune response to the vaccine, indicating that stress may be associated with decreased immunity, exactly what I just said. In another study, 235 adults were categorized into either high or low stress group. Over a 6-month period, those in the high stress group experienced 70% more respiratory infections such as the flu and had nearly 61% more days of symptoms than the low stress group. Similarly, another analysis looking at 27 studies showed that stress was linked to increased susceptibility of developing an upper respiratory infection, again, because stress decreases immune response. So, these people that are walking around now that say that I'm not going to get the COVID vaccine because I have a very good immune response, I take your supplements, I exercise, I do everything right, I'm going to trust my own immune system to protect me. However, if these people, I hate to say it, if these people encounter some unexpected stress, their immune system can go right down. So if they are unlucky enough to come in contact with someone who has the virus, their immune system is not going to help them. They will get sick, and this has happened to thousands of people. Thousands, literally thousands. Another sign of increased stress, decreased energy, and insomnia. One study of 2,483 people found that fatigue was strongly associated with increased stress levels. When you're under stress, you're worrying, and it's very hard to fall asleep, and could cause insomnia. Not getting enough sleep itself causes feelings of fatigue and low energy. One small study found that higher levels of work-related stress were associated with increased sleepiness and restlessness at bedtime. Another study of 2,316 participants showed that experiencing a higher number of stressful events was significantly associated with increased risk of insomnia. Of course, again, here we go. These show association between stress and insomnia, but there are other things that could play a role that you can't really determine. It's very hard to determine if stress itself is a direct cause of decreased energy levels, although it makes sense that it would be. Other sign of increased stress is changes in libido or sex drive. A lot of people, when they're under stress, they lose their sex drive. They just have no interest in it. One small study evaluated the stress levels of 30 women and then measured their arousal while watching a porn film. Those with the high levels of chronic stress experienced less arousal compared to those with lower stress levels. Another study consisted of 103 women, and they found that higher levels of stress were associated with lower levels of sexual activity and satisfaction. Still another study looked at 339 medical students, and it reported that high levels of stress negatively impacted sexual desire, arousal, and satisfaction. Again, many other possible causes of lower sex drive, including hormonal changes, fatigue itself, and psychological causes. Maybe you hate the person you're with, that would kill your sex drive. Digestive, you can also, stress can affect your digestive system. You can produce symptoms such as diarrhea and constipation. One study looked at 2,699 children and found that exposure to stressful events was associated with increased risk of constipation. Stress may especially affect certain digestive disorders are actually strongly stress-related. These include irritable bowel syndrome and inflammatory bowel disease. You get symptoms such as stomach pain, bloating, diarrhea, and constipation. These have an extremely close relationship with stress. High daily stress levels were associated with increased digestive distress in 180 women with irritable bowel syndrome. An analysis of 18 studies that investigated the role of stress on inflammatory bowel disease found that 72% of studies found an association between stress and digestive symptoms. So that, you could say that sometimes some scientists refer to the gastrointestinal tract as the second brain, because that the gut is strongly affected by outside influences such as stress, and they can produce these symptoms. You can also have appetite changes when you're under stress. You might either eat too much or eat too little. One study of college students found that 81% reported that they experienced changes in appetite when they were under stress. 62% reported an increase in appetite, while 38% lost their appetite. In a study of 129 people, exposure to stress was associated with behaviors like eating without being hungry. A lot of people, that's called emotional eating. Whatever happens, a breakup, someone in the family dies, they get this urge to just eat, because the eating stimulates brain chemicals called endorphins, which actually make you feel a lot better. It's called emotional eating, and again, it's related to stress. Another very common symptom of stress is depression. A study of 816 women with major depression found that the onset of depression was significantly associated with both acute and chronic stress. And a study of 240 teenagers found that higher levels of depressive symptoms also were linked to stress. A study of 38 people with non-chronic major depression found that stressful life events were associated with depressive episodes. So another symptom of high stress, rapid heartbeat, also known as tachycardia. One study measured heart rate reactivity in response to stressful and non-stressful events, finding that heart rate was significantly higher during stressful conditions. Easy explanation for this: when you're under stress, your body releases more stress chemicals, or hormones, I should say, such as the catecholamines, epinephrine, norepinephrine. Epinephrine and norepinephrine, when secreted in high quantities, stimulate the heart. They cause the heart to beat faster. They increase the strength of heart contractions. As a matter of fact, a common drug prescribed by physicians to treat people that have had previous heart attacks are called beta blockers. These drugs work by blocking the receptors in the heart that epinephrine and norepinephrine interact with, and by doing so, it prevents overstimulation of the heart and hopefully a second heart attack. So, there's a definite relationship between your heart and stress. Another study of 87 students who were involved in a stressful task, it was found that to increase heart rate and blood pressure, but playing relaxing music in the background actually reduced the feeling of stress. But there's other things that can cause a rapid heartbeat besides stress. These conditions include hypertension or high blood pressure. If you take too many thyroid drugs, you're going to get a very rapid heartbeat. It can happen to bodybuilders who use thyroid hormones to get cut up or defined. Certain heart conditions themselves related to the heart rhythm can also cause a rapid heartbeat. If you drink too much coffee, I've experienced it myself. If you drink, let's say, 8 cups of coffee in a row, your heart is going to beat quite a bit faster. Luckily, it's usually temporary. Drink too much alcohol, it can cause a fast heartbeat. All these things can cause a fast heartbeat. When you're in distress, it's very common to also have excessive sweating. A study of 20 people had something called palmar hyperhidrosis, which is excessive sweating in the hands. They basically showed, when they were under stress, they showed much greater rates of hand sweating compared to when they're not under stress. So excessive sweating, again, can be caused by other things, including anxiety, heat exhaustion, or just being in a hot area. I sweat when you sweat when you work out, that's normal. Excessive thyroid, again, can cause raising metabolism so high that you start sweating like crazy, and the use of certain medications. So basically, what I've discussed here, these are all common signs of stress. And as I said, an upcoming article in my Applied Metabolics newsletter, I'll discuss the myths and truths related to how stress really affects health. And trust me right now, There's a tremendous amount of misconceptions about that. And speaking of Applied Metabolics newsletter, there is no digital publication in existence that can equal the depth of information that you find in Applied Metabolics. It's 40 to 50 pages every month. It's more like a monthly ebook. No advertisements, just pure evidence-based information with the additional bonus of my personal experience of nearly 60 years of constant study and being in the gym. I've tried various techniques. I know what works and what doesn't. You'll find various topics. No other digital publication covers as many topics as I do in Applied Metabolics, including nutrition, exercise science, anti-aging research, supplement science, which ones work, which ones don't. I'm not associated with any supplement company, which reminds me, I just saw a video I have to tangentially add here. I saw a video where this guy was giving a review of pre-workout supplements, and I'm watching this guy and I'm thinking, well, as if and he actually named names. He actually showed the products themselves, which he considered garbage pre-workout supplements. And I'm thinking, all right, this guy's pretty good. And at the end, what does he do? He gives a big spiel for his own pre-workout supplement. See, that's something you're not going to find. It was basically a disguised advertisement. He got you to listen to the whole thing so you could have him, sell you his pre-workout supplement, which probably was no better than the ones he was talking about. But in any case, you won't find that kind of stuff in Applied Metabolics. I have a cover women's health and fitness, ergogenic aids, hormonal therapy, all of these topics covered in extreme detail. After 6 months of reading Applied Metabolics, you'll be kind of an expert yourself. I guarantee that. No matter what your level of education, you will still learn something from Applied Metabolics. I have various health professionals that are subscribers to Applied Metabolics, medical doctors, all kinds of various branches of science, teachers, because they know that I'm telling the truth. There's no lies. It's 100% true. No BS. I counter all the crap and bullshit that you encounter on the internet, where about 90% of what you read related to health and fitness is wrong, incorrect. You won't find that in Applied Metabolics because I have the knowledge and experience to steer you in the right direction. So subscribe today. www.appliedmetabolics.com. When you subscribe, I'll send you an invitation to join my private Applied Metabolics Facebook page, where every day I post new information on nutrition, exercise science, general medicine. I also have an email portal on my Applied Metabolics webpage. With current subscribers only, I don't accept unsolicited questions. You can send me short questions. I'll be happy to answer up to a point. There's been a couple of people that have tried to ask me 2 to 3 questions a day, every day. You're not going to get that for the very, very inexpensive $10 a month cost of. I mean, come on, that's what's called abuse. So, I will answer from individuals. I'll answer, let's say, up to 3 or 4 questions, and after that, I won't respond, because if you want any more than that, you're going to have a paid consultation with me, and that's what any professional person would do. Your doctor, your lawyer, anybody who has any knowledge. That's what they do, because everybody has bills to pay. Everybody has to exist. So that's about it. If you want to have the best friend you'll ever have, go to your local shelter, adopt a dog. Thank you.